By trigeminal neuralgia, and what is the management?
Trigeminal neuralgia is one of those really distressing kind of pains which is due to a number of different reasons which affect the trigeminal neuralgia. Now, you can have a blood vessel which is coursing very close to it and causing compression of the nerve. In that case, the treatment is easier because you can go in for gamma knife surgery or open neurosurgery, where they can either put something between the vessel, blood vessel and the nerve. Sometimes you don't have it's a tumor which grows, then it needs surgery, but oftentimes we find no specific cause for it. And it results in lancinating, shooting, sharp, severe pain, which lasts for seconds at a time, but is so terrible.
So terrible.
And is triggered by wind, water, touching, anything. I mean, you're right, the people have been known to commit suicide. In short, what is the treatment? We can start from the neuropathic agents, and essentially in pain medicine, there's only carbamazepine is used only for this condition. Carbamazepine, oxcarbamazepine, lamotrigine, number of these. They do injections into the trigeminal ganglion region. We do radiofrequency, pulse radiofrequency. And in the most severe cases, then of course, they need surgery.